Hi everyone, welcome to Raaonline. This is Dr. Ashok, consultant microbiologist. So today we are going to see about an case study series which is pertaining to the infectious diseases. So today we are going to see about a respiratory infection, mainly the Bordetella infection. So here I will show you a case and I will show you a set of questions, let us answer one by one. So we have already learned about this particular infection in the last class, and let us apply the theoretical knowledge and let us try to solve this particular clinical scenario. So here we are going to have a 4-year-old boy who was brought to the pediatric outpatient department with a complaint of cough and post-tussive vomiting since 2 days, and fever and flu-like illness was present for the past 6 days. So here the patient is having an post-tussive vomiting. So patient is going to have cough and post-tussive vomiting for the 2 days, and for the past 6 days the patient had fever and flu-like illness, and it's going to be a pediatric aged child. So he's going to be a 4-year-old boy. So on examination, there's going to be a cough and there's going to be a rapid inspiration against closed glottis at the end of paroxysm. So this particular etiological factor can lead to something called an whooping cough. So what is the diagnosis? So the diagnosis is going to be the whooping cough. And question number 2, what is the etiological factor? So we all know this particular whooping cough is going to be caused by an gram-negative organism, microbe. So it's going to be called as this particular infection. The etiological factor is going to be the Bordetella pertussis. And what is the morphology?